Welcome to The Explainer. So, today we're unpacking something absolutely crucial if you want to understand how institutions can just break down. We're looking at the anatomy of a total government failure, the Tuskegee Study. This is a medical case. It's a chilling lesson in what happens when the exact systems built to protect people are turned right against them. Think about this for a second. What actually happens when a government decides to let its own citizens die just for data? It's a heavy question, right? But we absolutely have to ask it. Because to really grasp the scale of this tragedy, we have to look at it through the lens of catastrophic state failure. A government literally prioritizing an experiment over human lives. Okay, let's dive into this. Part 1. The False Promise. Alabama, 1932. So the year is 1932. We're in Macon County, Alabama, right in the brutal grip of the Great Depression. The folks living here were deeply vulnerable, They were hungry, they were sick, and right at this moment of absolute desperation, the U.S. government steps in, and they make this incredibly benevolent-sounding promise. Free health checkups, free treatment, and free food. I mean, if you're a starving farmer in 1932, that sounds like a literal miracle. But the reality was a terrifying underlying agenda. There was no actual treatment. It was a secret experiment on active, calculated deception. And that false promise worked. It brought in 600 poor black farmers who showed up desperate for help, completely trusting their government to act in their best interest. They genuinely believed these officials were there to save them. They had absolutely zero idea they were walking right into a government trap. So let's break down who these 600 men actually were. The group was split. Out of the 600 guys involved, 201 were completely healthy. They didn't have syphilis at all. But the government's real interest, that was the other 399 men. Those 399 individuals were already suffering from the disease, and they desperately needed immediate medical intervention.
Which brings us to part 2, the deadly experiment, the bad blood deception.
The Tuskegee Study was, by its very definition, an experiment designed to observe how syphilis progresses in the human body when left completely untreated. And that right there is the crucial point, left completely untreated. The state was not there to cure anyone. Doctors made a calculated, cold-blooded choice to just sit back and watch as this illness systematically destroyed the human body over time. Now, to keep these men coming back to be observed, the government had to lie. We're told they simply had bad blood. The actual medical word, syphilis, was literally never mentioned. Craziest part? The government kept this specific targeted lie going for decades. They deliberately were completely in the dark about their true, fatal diagnosis specifically so they wouldn't go out looking for a real cure. Let's move to 1947 and see how this builds. Part 3, A Cure Denied, the 1947 turning point. To really grasp the sheer agonizing scale of this government cover-up, we've got to look at the timeline. It starts in 1932, right? But 1947 is the real turning point. This is the year the government's failure shifts from passive negligence into active, malicious sabotage. And this sabotage would continue relentlessly all the way until 1972. And here's exactly why that shift happened. In 1947, penicillin becomes widely available to the world. And it wasn't just some minor treatment, it was a 100% effective cure for syphilis. A single injection could completely cure a patient. The tragedy here is just staggering. A perfect, simple cure existed. The government literally possessed it, but they deliberately withheld it from those 399 men, basically reasoning that curing the patients would ruin their precious data collection. And it gets worse. The state didn't withhold the medicine, they actively intervened to block it. When some of these men were drafted into the army or help from private doctors, the government sent out warning letters. They literally told other doctors and army boards, do not treat these men, they are in our study. The state used its immense institutional power to ensure its own citizens were actively denied life-saving medicine. Part 4. The Tragic Toll. 40 Years of Suffering. 128. That is the number of men who died directly because this treatment was deliberately withheld from them. 128 lives just extinguished, families broken, futures erased, and all of it entirely for the sake of gathering data. These weren't unavoidable medical tragedies. They were calculated casualties of a massive, devastating state failure. 40.
Because the disease was left deliberately unchecked by authorities, the harm didn't stop with the men. 40 wives tragically contracted syphilis from their husbands. They were completely unaware of what they were being exposed to, infected entirely because their partners were being lied to by a government they explicitly trusted with their medical care. 19. This is perhaps the most heartbreaking number of all in this profound systemic failure. 19 children were born with congenital syphilis. They were brought into the world already suffering from preventable blindness and severe sickness, simply because a government agency decided a completely observational experiment was more important than protecting the health of its citizens.
Part 5, Exposure and Apology. The truth comes out. For 40 years, this whole operation was a highly protected government secret. That is, until 1972, when a journalist named Peter Buxton had the immense courage to leak the story to the newspapers. And when this news hit the public, it absolutely shocked the world. The backlash was so immediate and so severe that the government shut down the 40-year experiment within 24 hours. Just think about that. One person's courage forced the government to instantly halt a decades-long horror.
But it took another 25 years for the government to actually formally answer for this. In 1997, President Bill Clinton invited the remaining families to the White House and issued a national apology on television, stating, "What was done was wrong, oppressive, and unforgivable." Now, this brought some official closure, finally acknowledging this profound systemic government failure. But as you can guess, the irreversible damage to these communities was already done.
Which brings us to Part 6, The Lasting Impact, a Broken Trust.
So, in the aftermath, the government tried to make amends, right? They provided financial compensation to the families, they built new medical facilities. But that generational trust, it was permanently broken. No amount of money and absolutely no new hospital building could ever repair the deep psychological damage inflicted by a state that so callously lied to its own people for 40 straight years. And there is a direct line from 1932 right up to today. The legacy of the Tuskegee Study is a deep-rooted medical mistrust and vaccine hesitancy among Black Americans that still exists right now. Because this wasn't just a medical failure, it was racism. And it was a grotesque abuse of state power that birthed a very real generational fear of doctors. The source material distills the core lesson perfectly here. When knowledge lacks humanity, it becomes the ultimate weapon. Science and data are incredibly powerful tools for sure, but when the state strips away the humanity of its citizens just to gather that data, well, that knowledge transforms into a weapon of mass destruction against the vulnerable. So I want to leave you with this. Once a government so fundamentally shatters the trust of its people, how many generations does it take to rebuild it? The shadow of systemic betrayal is incredibly long. I really hope this explainer helped clarify the mechanics of this massive government failure and why it still resonates so deeply today. Thank you so much for joining me. Keep asking.